I'd like to start just by asking, do you currently have health insurance coverage?
Yeah, I sure do. Yes, I do.
And are you happy with that coverage currently?
Yeah, I've got great healthcare coverage, so I'm happy.
Do you currently have healthcare coverage?
No.
No, you don't. Okay. Do you currently have health insurance coverage?
Yes, we do.
Yes. And are you both satisfied with that coverage overall, or how do you feel about your current state of things?
Ooh. Everything could be better, but we don't take it for granted that we have coverage. So it's pretty good. Does well for us.
Do you currently have healthcare coverage?
No, I don't.
You don't.
No.
Do you currently have healthcare coverage?
Yes, I do.
Okay. And how satisfied are you with that coverage?
Well, it's pretty good. I got Medicaid and Medicare. It's pretty good.
Currently have healthcare coverage?
I do not.
No, I'm not, because I currently don't have health care.
I work for the federal government, so I get a choice of what healthcare provider I get my personal health care through.
Currently, I don't have health care because I'm a consultant and I can't afford I can't afford health care right now.
Okay. Are you familiar at all with the bill that's currently being discussed in Congress that would potentially give health care to people who don't currently have it?
No, not really. I'm kind of confused with it myself. I don't understand it. It's too mixed up for me to understand.
Right. Do you support the general idea of the government providing health care to people who don't currently have it?
Yeah, I'm for that. I'm for it. I don't have it, and I need it.
Okay. Would you support similar programs such as providing food or shelter to any American who doesn't have those things as well?
Yeah. Yeah. It's too cold to be sleeping outside.
Okay. So you basically feel that
People being hungry, man. There's too much hunger out here. Too much food going to waste, and they need to give it to somebody. Some people need to eat.
Okay. So are you familiar at all with the proposed health care legislation that's currently being discussed in Congress?
Yes, I am.
What is your opinion of that bill?
Well, personally, I think everybody should have health care all over the world, not just the United States, but the third world countries as well. And I think since the United States made so much money in these other countries, they should provide a health care even for them. That's what I think.
Okay, so you don't just consider it something we should do in the United States, but the United States government should subsidize health care all over the world.
Yes, I do. Yes,
what you're saying?
Yes.
Okay. Legislation that could possibly make health care available to those who don't have it currently.
Is it free? I like free.
Well, there's a couple different provisions. One of them could be that it provides free health care to the public. Is that something you think you would support?
If somebody gives me free health care, I say go for it.
Okay.
If you want to take an extra $10 a week out of my taxes to make sure everybody's fed, make sure people are clothed and have a place to live. Granted, there's people that take advantage of the situation. I mean, the welfare system's ridiculous right now. There's people who legitimately need it, and there's people that don't need it. And the people that don't need it seem like they're taking more advantage of it than anyone else. But I honestly, if my $10 a week out of taxes were legitimately helping someone, I have no problems paying more. $20 doesn't matter. I think if those people are stronger, our country's stronger, everyone wants to work together.
Do you think there's a way we can make sure that the people getting it are those who truly need it, or is it just something that can't be avoided, where people take advantage of the system and people can, lazy people can get everything they need in life?
I think if it's done correctly, I think if take political figures out of it, put everyday people in charge of that, where they have no benefit of giving it to this person or that person, where they make a legitimate. Make sure people are really trying to get a job. I know people on unemployment that get applications just to do it, just to keep on unemployment. It's like, oh, that's cool. I was unemployed for 5 months. I still looked for a job.
So you're saying you wouldn't necessarily support a public option of giving everyone health care who needs it, or can you explain a little bit more what you mean?
There needs to be limitations. I think that there's just kind of a misconception on this overall health care bill, and I think that it needs to be itemized, and they need to look at it a little closer. You can't just say health care for everybody and let everyone just, like you said, run rampant and just go all out. So